Good? Okay. You took a shot at the audience? Hello, good afternoon. My name is Suhail Lopez, and this is the informative speech for the public communication class at Austin Peay. So, how are you guys doing today? Good. Thank you for coming and be here at my speech. I really appreciate it. Today's speech is about weight loss surgery. And I wanted to let you guys know that it is a very difficult decision to make, and that when people are educated about it, it's easier to make this decision. It is a long-term commitment, and it is something that is like for life. I mean, you alter your anatomy like forever. I want to read you some statistics that I found in the internet. It says, results from the 2007-2008 National Health and Nutrition Examination Survey indicate that an estimated 34.2% of American adults, so that means 20 years or older, are overweight. 33.8% are obese, and 5.7% are extremely obese. According to WebMD, about 220,000 people in the United States alone had weight loss surgery in 2009. For the thousands of people affected by obesity, the decision to have bariatric surgery is not easy. It can be a matter of life and death. This is not a simple procedure, and it produces life-altering changes. Why being informed is important. You need to know the what, the when, the where, the how it's done, where you get it done, who's going to do it for you, because if you don't have all this information, you're not going to be able to make the decision to do it. It is important also to be informed as a friend, as a family member, because support is very needed when people make this decision. I made the decision 10 months ago. It started last year in November. I had some sleeping issues, and it just went from there, and I had the surgery May of this year. It's been quite interesting. It's been a battle every single day. It's been a tough road, but as you see me, there's a new me now. There's half of me. So I want to give you some details about how everything starts. So what makes you a candidate? What makes a patient a candidate for weight loss surgery? Well, the first is going to start with you going to your primary care provider, and he's going to ask you about 3 questions. Okay. The most horrible about what's your current weight. We never want to give it out, but it's very important. So, you know, he's going to do your weight and see how much you weigh. What he's looking for is to see if you're from 90 to 100 pounds over your ideal weight. If you're over that, you're considered obese, and there's like different levels of being obese. The second question is going to be, what's your body mass index? I want to show you a chart so you know what I'm talking about. This chart right here, there's a mathematical formula that the doctors determine how to get your body mass index. If it's over 40, you're officially considered obese. If it's between 34 and 39, the doctor is going to stop, because he is going to tell you, yes, you're overweight, but then do you have the following conditions, which are sleep apnea, or acid reflux, or a fatty liver, hypertension, diabetes. Those are like the main diseases that a person can have when they're overweight, mostly caused by overweight. If you answer yes to any of these questions, then you're definitely a candidate for bariatric surgery. After this, if you decide the doctor is going to go over, your choices to losing weight, and bariatric surgery is going to be mentioned because this is 2011 and people are going that way a lot, like myself. After this, if you make the decision to have bariatric surgery, you will be referred to a bariatric surgeon. Once you're there, the bariatric surgeon is going to go over the different kinds of surgery that there are. There's basically 2 of them. There's gastric banding, and I want to show you what it is today. Is that good? Gastric banding is a band, a silicone band, is wrapped around the upper part of the stomach to form a small pouch. This is done without using a surgical stapler or cutting into the stomach walls. The regular ones used are called the lap band and the vertical gastric banding procedure. So basically it's like, if you want to call it that way, it's like you're putting a rubber band around your stomach, and the food intake is very small. And you basically want to eat as less as possible so it doesn't go through the band, because if it goes through the band, then that's how we start gaining the weight, and that's why it's ineffective. The second one is the gastric bypass, which is what I had done. This one is the harder procedure. The surgeon forms a small stomach pouch completely separated from the bottom part of the stomach by stapling and by completely dividing the stomach from itself between the rows of staples. The food will bypass this now separated lower stomach. So this is how our stomach looks right now. This is how we are. What they did actually, they went in, they did 6 incisions, and they cut. My stomach is still there, but this is my new tummy right here, right now. So it only holds about 2 ounces of food every time I eat. With time it will get bigger, but let's hope not, so you can fit more food in there. But this part right here is still in my body, but the food bypasses it because it's not attached to my new stomach anymore. So it goes from that little pouch right there into the intestine, and it gets digested and all that stuff. So after you go through the options that you have, they're going to prepare you for the surgery. There's a few tests that you have to get done. You have to provide the doctor with your medical history and your family's history, because that's how the battery test is going to depend from there. They're going to talk about insurance coverage. Some insurances cover it if you can present proof that you have other comorbidities like the sleep apnea and the diabetes and all that stuff. And the other way of paying for the procedure is paying it out of your own pocket. Also, they're going to discuss educational info like what I'm telling you today. They're going to tell you to go to seminars. They're going to tell you to go to support groups. And all of this is before the surgery. They're going to talk to you about everything. They go over with you about it with you. The battery test is blood work. You go get a sleep study done. You get a consultation with a nutritionist, a consultation with a mental health specialist. You have to go to a cardiologist to get cardiac clearance for the surgery. You also go to a pulmonologist to have a breathing test done so you can get pulmonary clearance. You have an abdominal ultrasound, and you also have an upper GI series, so it's an upper endoscopy. You get all that done so they can see everything's in there, how big the stomach is, how are your intestines, if there's anything else going on that they have not noticed. They also can notice if there's any gallstones and all that stuff. So they need to check for all of that. After that, basically after all of that is done and you get clear for surgery, you're basically just waiting for the surgery day. What happens? It's going to be done at the hospital or a bariatric practice that specializes in the actual procedures. What to pack? You're just going to pack clothes to stay at the hospital from 3 to 4 days. Hopefully there's no complications. You don't have to stay there longer. Who do you see? You are going to see your surgeon. You're going to see the anesthesiologist. You're going to see the nursing staff, and you're going to see the assistant team. So what happens? They are going to take your vitals, and they're going to put an IV line on you because that's how they're going to give you the medication to put you to sleep, and that's how they're going to feed you while you're after the surgery. And after that, it's just rolling into the OR and getting ready for the big show. Gastric bypass takes about 2 to 3 hours in surgery in the operating room, and gastric banding takes about 45 minutes to 60 minutes, so it's really not a long procedure. So after the surgery is done, they put you back into the recovery room, and it's a lot of pain because you're like groggy, and then you're waking up, and you know there's a lot of soreness in this area. It's like unbelievable pain, but the nursing staff takes care of you because they're really good about pain management because it hurts a lot. I mean, 6 incisions and you're all swollen, and you also have a drain right here that's trying to take all the fluid that's in the stomach, make sure it doesn't leak into the new stomach, and make sure no leaking on the new connections because there's new connections to the intestines. So what happens after the surgery? Your new life starts. Make sure, if you know someone, you tell them to follow the doctor's orders to the T. If you don't follow the doctor's orders, there's not going to be any good results from the surgery. It doesn't even matter if you're only eating a little bit. I mean, you can get sick, like vomiting, you can get diarrhea, you can get headaches. It's nasty side effects. Also, the doctor is going to give you a prescription for painkillers, so they can control your pain management for about a good week and a half. After that, you have to take vitamins and supplements for the rest of your life, because the surgeries can cause some nutrients deficiency. You have to exercise, you have to walk, keep active because you avoid blood clots, and you need to keep exercising because you need to keep your body, tell your body that the body needs to burn fat instead of your muscle fat. You also have to monitor what you eat. Just because you have a smaller stomach doesn't mean you get to eat all the junky food you used to before. So, you know that for me no more Coca-Cola or Burger King or pizza. That's it for me no more. Make sure you hydrate all the time. If you dehydrate, that will mean a visit to the hospital. I was at the hospital 3 times after I had the surgery, and that was not fun. No, they already knew me at the emergency room. That's not good. But it was not, like I said, it was not easy to make the decision, but I'm glad I did it. Gastric surgery is a good solution for obesity, especially if you have tried before and you haven't had any successes. So if you guys know anybody who's trying to make this decision, support them, because it takes a lot, but it's worth it. Because now, you guys see me, you saw me how I looked before, but I did bring pictures so you guys can see the difference. And there's that. I don't know if you can see the difference there. Here.
He's in Europe traveling now, so we can't get the wife.
And there's this too.
And National Direct wants to know nothing about it. It won't help me,
What?
nothing. He emails me a letter to close it. I have to see
And I'll tell you my secret, which I don't tell everybody a lot. This was my number when I had the surgery. That's how much I weighed. And today, I took the weight today. So, a few months later and 100 pounds lighter, this is the new me, and I'm glad I made the decision. Thank you.